of the most interesting things I learned in medical school actually wasn't from one of my professors. More so, one of my professors in surgery told me to read the book Cope's Acute Abdomen. And I remember my spring vacation taking the book on the beach and reading it. And it was a fascinating read about how patients will actually tell you their story and tell you their diagnosis, and our hands are the most precise tools that we can use to make a lot of diagnoses. And it helped me along my entire surgical career, where I would pick out appendicitis or diverticulitis or other slight abnormalities from patients who presented with certain diseases well before anybody else. I distinctly remember being in clinic as a third year medical student, and a patient came in for a hernia, and I just did a thorough exam and put my hand on his belly, and I felt this large pulsatile mass, which is an indication of an aortic aneurysm. And we ended up getting an ultrasound, and he had a 10 centimeter aneurysm. Because I spent that time, a little extra time examining the patient, we were able to get him into the operating room and fix his aneurysm. And as a third year medical student, I got to scrub in on a really interesting case. Listen to your patients, examine them, don't stare at the computer screen, look at your patients in the eye. They're going to tell you what's wrong with them.